Hello, my name is Brad Roberts, and I'm the director of a new allied health school located at Baylor Scott & White, the Heart Hospital in Plano, Texas. I'm also the program director for the school's first program, Adult Echocardiography, which uses ultrasound waves to image and measure blood flow in the heart. Baylor Scott & White, the Heart Hospital Plano, is a nationally recognized 114-bed hospital that specializes in the latest techniques in cardiovascular surgery and interventional therapies, and is the perfect place to support an allied health school like the Cardiovascular Institute. Over the next few minutes, I'll let you know about the exciting career opportunities that could be here for you. Our program encompasses three main facets to it. There's the didactic part, which is the classroom setting, which you're all familiar with. We also have a scan lab, which is dedicated to training the students on how to scan each other with ultrasound equipment and get the images that we need to perform echocardiograms. The third piece of our program entails the clinical part of it, and that's where the students actually go into the hospital and learn from other experienced sonographers on how to scan and deal with patients. We have some of the best sites in the Dallas-Fort Worth area because they're all Baylor Scott & White Health affiliates. This is one of the strongest parts of our program.
I'm Michael DeMaio, the Chief of Staff and Director of Research and Education for the Heart Hospital. We are happy to welcome you to the Adult Echocardiography School. This is an initiative taken on by the Heart Hospital to continue the excellence that we experience in clinical care as well as education. I'm a cardiac surgeon or heart surgeon, and it is critically important that we understand what's going on inside the heart. That is partially done by performing a cardiac echo, which is looking at the structures, chambers, muscles, and function of the human heart. In this curriculum, you will understand how to capture the pictures that are so important in order to perform heart surgery and fix the issues or problems that occur every day in the United States. This program is a tremendously broad curriculum with excellent teaching and clinical support. We have a world-class faculty, which includes Dr. Zui Wong, who is considered a true expert in clinician and the performance and education of cardiac echoes. We have a combination of excellent teaching, education, and exposure to patients as inpatients and outpatients. All of this will yield to an outstanding education and a tremendous career.
So our program exists over a 52-week period, and it's broken up into 3 semesters. The first semester covers normal anatomy and physiology and what that looks like on an echocardiogram. And we also spend a lot of time, 12 hours a week, scanning each other in the lab. Along with this, we'll be taking ultrasound physics and learning about how sound interacts in the body and how it is that we make the images that we make. In the spring, we start to introduce pathology into the curriculum, and the students start to learn about the different things that could go wrong with the heart and what that can look like on echocardiography. We also have labs still ongoing, and those labs will go along hand in hand with the didactic material. So whatever pathology we cover in the lab that afternoon, we'll talk about how to scan for that particular pathology, say aortic stenosis. On Tuesdays, physics will still continue, and importantly, the students will, for the first time, start their clinical rotations and learning what it's like to actually do this profession. In the summer, classes go down to just 1 day a week, and there's no more labs. The classes are focused on more advanced cardiovascular pathologies and techniques that we have available with echocardiography, and there's more advanced applied physics in that semester. And the students are going to clinic 4 days a week, so they become more immersed in the clinical environment as they go through the program. The physics class also covers a registry review to get the students prepared to take the national board exams before school is out.
Hi, I'm Mark Valentine, the president of the Heart Hospital. I'm excited to kind of share our vision of the ultrasound school. It has been a vision of our hospital for quite some time. We are a teaching institution in a community setting, and there's a huge need for allied medicine professionals at the Heart Hospital and around DFW. So a team led by some of our physicians and myself looked at what institutes of technology that could be hospital-based could be developed at the heart hospital. And cardiovascular ultrasound was the #1 need of our hospital, the community, and the region. I want to thank you for your interest in choosing the heart hospital as potentially a future program for you to be enrolled in and work with us each and every day. You'll see the best technology, the best innovation, the best cardiovascular medicine across DFW and the country here at the Heart Hospital. Look forward to seeing you soon. Thank you.